Then they follow one way, they come. See my car, see where I'm supposed to come from. Third mainland, normal road. See where they come. Then they follow one way, they come. I can't stop them. Then they tell me, say, make I pass here. Look at them, oh. Look at their faces. I'm not leaving this place for them today. Look at me. I'm not leaving this place for this.
So the voice you just heard is from a video shared by a Twitter user. His name is Adedapo, and he shared that video on 16th September 2022, where he prevented LASMA officials from driving against traffic. It's funny because LASMA actually means Lagos State Traffic Management Agency, and they are the ones who are driving against traffic.
Authority.
I know, right?
It means authority.
Authority. Oh, sorry. Oh, LASMA, authority. What did I say?
Agency.
Okay. So authority, force. Okay, so the video generated a lot of traffic, a lot of engagement, conversations on social media. But for me, I think the key thing from that shows how what happens when citizens have the right information, about issues that affect them, and also decide to act on that information. And it's simply what we call active citizenship.
I know that you enjoy telling stories, but can we at least introduce our podcast first?
Calm down, man. I was heading to should have stayed with me. But yeah, we are excited to bring you the Break It Down podcast from Nigeria Health Watch. My name is Chibuike Alaboso, and I will be your co-host. Your favorite co-host, actually.
Okay.
You know what I'm saying?
Sure. And I am Asari and we're super delighted to bring you this podcast. The Nigeria Health Watch is a health communication and advocacy agency. Are we an agency or an authority?
We are not organization. We're not LASMA.
So Nigeria Health Watch is a health communication and advocacy organization based in Abuja, Nigeria. And on this podcast, we will be explaining different policies and how they affect us, especially the quality of healthcare that we receive.
It's actually easy, to think that these policies don't concern us. I mean, when you mention policy, I'm sure a lot of people out there like, do you want to be policy again? How do I want to concern me, in pidgin? And understandably, nobody will just pick up a policy document and start reading. But this is really us, what the Break It Down podcast wants to achieve. It's bringing out the meat of the matter, like they say. So you can use this information to demand for better health care. And importantly, to be an active citizen like Mr. Dedapo here, because when you know, then you can use that to, ask better questions, engage better, and also, demand for better healthcare wherever you access healthcare. But like you've mentioned the name of the podcast, Break It Down. So what in the spirit of breaking things down, let's start by. So you said Nigeria Health Watch is a health communication and advocacy organization. But
yes, we are.
And we talked about policy again. So, but what really is advocacy? So let's start breaking it down. And also, when you say policy, what is it?
Why are we breaking it down with me first? I don't understand.
Please now, just break it down, Joe. I beg, just break it.
Okay. So advocacy really is just speaking out about issues that concern you, issues that you care about. So for us at Nigeria Health Watch, it is healthcare, as our name implies, and everything around it. So we use various means to speak out or generate support for better healthcare for Nigerians. Now, policies are just those documents that make governance easy. So you can say that they're like rules or regulations, like a house can have their rules about coming back late, that sort of thing. So if you go against that rule, you are asking for trouble.
Serious trouble.
Exactly.
I really like that explanation. It reminds me some families where the dad will be like, my policy in this house is that you must come back before 8 p.m. or 9 p.m. Anytime after that, you sleep wherever you're coming back from. But yeah, it's really what it is, helping us understand those things, breaking them down so we can use them better to make better decisions, ask for better health care. So if you are really someone who you're always curious about learning things, understanding how things work, and using such information to engage better, to ask better questions, you should listen to this podcast.
Absolutely. And I think one of like the key takeaways from this podcast is that we're breaking down policies that affect every part of our daily lives.
Yeah.
And we're trying to explain why it is important for everyday Nigerians to understand it. Right?
I agree. True.
Okay, so now I've said that too, but shouldn't policies be for policymakers and government officials only? Or like all those technical people?
I get what you're saying. I mean, that's the first thing that comes to mind. Though policies is technical, it's government or the experts and the rest. But I think you also answered the question, in what you said earlier, that these policies, they are for us. They affect every part of our lives. Our everyday activities, education, health, just name it. Yeah. So, and for us, it's over, we said earlier how Nigeria Health Watch is a health advocacy organization. And doing this over 15 years, we understand the importance of community. How, yes, these things affect us, but we can't do it alone. Yes, we do our advocacy, all our strategies and all, but then we want to have more people like Adedapo, that community of more people joining in demanding for better health care. So that's really why we think it's important to have these break it down podcasts. And this can only happen if people understand the issues, and we break it down, they understand the issues, they can now use that information to ask for better health care, demand for better health care, engage better across board.
I get that. I mean, and truly, what better way to ask for something than coming with actual facts and
exactly
showing like a good understanding of the issues. I also like that you mentioned community. This is something that is very important in the Break It Down podcast. So we're going on this podcast journey with you, our listeners. So please feel free to always reach out to us with questions about issues that you want us to break down. If you have like any personal experiences receiving healthcare, which I know we all do,
right.
Please share them with us.
Day.
Honestly, I feel like every time I go to a hospital, I have something new to complain about. But anyway, please share them with us. Yeah. You can send us an email or send us voice notes via our WhatsApp, which we'll play during an episode. Whatever works for you,
the community.
Please do it. Exactly. We'll put those details in the podcast description. I'm looking at our producer. Shay, you put it in the podcast description. He just made a face. Anyway, so you can reach out to us also via social media. And I think we're on Facebook, we're on Twitter. I know that we are, okay? Favorite co-host. I know that we're on Facebook.
Representing. I'm here for you, people.
So yes, please reach out to us. Whichever way works for you, we're here.
And I think we can actually invite our listeners to be part of the show. So that would be so cool, wouldn't it?
Yeah, that makes a lot of sense.
So you have, it wouldn't just be the two of us breaking down or explaining these things every day. So we can actually invite our listeners to be part of.
I agree. But are you saying that people are going to start getting tired of us? Are they going to start listening? They are going to stop listening to us?
Why are you like this now? Of course, that's not what I'm saying. Not when the favorite co-host is.
That's right. Anyway, we'll be bringing in experts to help break down these issues, but we will promise you one thing. They must break it down. There's no speaking in technical jargon. Anyway, Misha, if I don't understand, I love to ask questions, so I will be asking all the questions.
Yeah.
They must simplify it, or we just will not let them go. And if you feel like we didn't do any justice to any, or if we didn't do justice to any episode, please just let us know, and we will be more than happy to do it again.
Very important, because it's all about breaking it down. If they don't, you might as well just lock the door and tell them, you must break it down or else we won't let you go. Anyway, so now you understand why we are doing this and why we are doing the Break It Down podcast, our why. Yeah? So Asari, can you talk to us about the how? How are we going to do this so our beloved listeners will know what to expect in each episode?
That's great. So we have structured this podcast in a way that it is very easy for people to understand what it is that we're going to be talking about. So the first thing we usually do is we'll pick something from our top 10 stories of the week. So usually Nigeria Health Watch publishes the top 10 health stories every Friday. So, or every weekend, we'll pick something from there. We'll talk about it. We'll pick something from listeners. If you sent us something that's interesting, we'll play it and we'll talk about it. Then we'll introduce the topic for the episode, interact with our Break It Down special guest, if we have a special guest. And then we'll give shout outs to an organization that's working in the area or like in the area that concerns the topic of the day.
Yeah.
And then just any other business, we'll give you announcements and then our closing. End of story.
I think the part about shout out is very important because it's really something we believe in at Nigeria Health Watch. While we are advocating for all of these issues, pushing for one thing to be better maternal health care, better preparedness for epidemics and the rest of it. But we understand that there are people who are also working to make these things work, to make these things right. So that's an opportunity for us to, shout out to them and, encourage them for the amazing work that they are doing.
Yeah.
So it's something we call solution journalism anyway. But we'll be happy to be doing that in each episode. But what happens if we don't find anybody that is working around that area?
Okay. It's an opportunity for our listeners to tell us if they know an organization working in that area.
Right.
So if you tell us, we'll shout them out in the next episode.
True. So remember, this is a community. We are doing this together, and we're happy to have you give us feedback on who is doing what around the issues that we'll be discussing.
Yay.
So there you have it. I hope you are as excited as we are, and you have some clarity on what to expect in the Break It Down podcasts.
Yay! You can start engaging with us now.
Now.
Tell us your expectations, issues that you want us to look at, and even people that you want us to invite. Remember, this is a community. The Break It Down community.
Yes.
Break it down.
But in the spirit of, if we're in a good mood, maybe when we are closing each episode, we mention what to expect in the next
episode.
Depends on the mood, Sabi.
The mood is always going to be great.
I know, right?
So
when the favorite co-host is here, I know it has to be. Anyway, but in that, can we talk about any tips of what to expect in our first? Because this is the first episode, but this is just us trying to help our listeners understand what to expect. But
so our first episode is going to be on the election because the election is literally right around the corner.
Very important.
Yeah. In case you want some expo on what it could be, you should follow the Vote for Health Niger hashtag on Twitter.
And all social media platforms, Facebook, Instagram, Nigeria Health Watch is there.
Yay!
Yeah, thank you for giving that
that brief expo
of what to come. But that's it on this episode of the Break It Down podcast. Until we meet you in the next episode, my name is still Chibuike Alaboso.
And my name is Asari and Deb.
Bye-bye.
C'est fini.